So hi everyone, and thanks Darina for inviting us to talk at this fantastic conference. So I'm just going to talk briefly about some research we're doing around support for people with dementia who live alone. So just to introduce this research is being conducted as part of a research fellowship funded by the NIHR and Alzheimer's Society. That's actually part of a national capacity building capacity in dementia research program. So there are 50 fellowships nationally, and there are 4 of us based within the Applied Research Collaboration in Kent, Surrey and Sussex. So that's the 4 of us pictured here. So why the focus on people with dementia living alone? So this was identified as a local priority area to focus on. I'm aware this is a sort of national, international conference. So by local priority here, I'm talking really about the southeast area of England, and particularly in those more underserved coastal and rural areas in this region that are sort of characterized by high proportions of older people, but also pockets of high levels of deprivation and health inequalities. So understanding the needs of people with dementia living alone has been sort of identified as a priority in these areas, including by sort of different system stakeholder groups, as well as people with lived experience. And I'm particularly grateful to the Lived Experience Advisory Panel who've helped to shape this work. So I'm hoping that this research will kind of contribute to a small but growing body of research nationally, internationally, focusing on people with dementia living alone. And this is important because typically sort of research, policy, services, things tend to be tailored around the dyad, the person with dementia and caregiver dyad focus. And it means that people living alone are at risk of exclusion. And people living alone are a diverse group. They live alone for different reasons in different circumstances. Some people will have family nearby, some people have no informal support. And of course, experiences will be shaped by different contexts and intersecting inequalities. But on average, the data indicate that people living alone are at greater risk of loneliness and isolation, that they're more likely to have unmet needs, concerns around safety and malnutrition, and more likely to be presenting in crisis, and also issues linking back to Ben's talk around kind of identification and diagnoses as well. But important to also recognise that many people can live alone and live well with dementia. And the pictures on these slides here just are from a report, the Dementia Inquiries report. So this is research led by people with dementia, where they explored the pros and cons of living alone. And I'm not sure if the text is big enough, but the quotes from this report, one person saying, "I pity those who haven't got a carer. I don't know what to do. I do without my wife." And someone living alone saying, "I prefer living alone as no one moves my things." So just highlighting the sort of diversity of experiences. But what we don't know very much about is the kind of particular kind of needs, challenges, experiences of people living alone in these more underserved coastal and rural communities, and what are the current system responses and gaps in this area. So I'll just briefly outline the research aims and methods. This is in process, so I don't have much primary data to present. Hopefully at the conference next year I will, but I will present some findings from a systematic review. So our overarching aim is to inform strengthening of post-diagnostic support for people living alone with dementia. Sorry, I've got a problem with the size of the screen. So first, an objective within this then is to look at what is the kind of current existing evidence for interventions or strategies that can support people with dementia living alone, and then focusing more in Kent, Surrey, Sussex and coastal rural communities through qualitative research to explore the experiences and needs of people living alone. What are some of the key barriers and facilitators to accessing support and social participation? And then from a service provision perspective, how are their needs being considered in service provision? What are some of the key challenges? And what are some of the promising practices we can learn from? And then to use these findings to co-develop recommendations. So briefly, in terms of methods, I'll come back to the systematic review in the next slides, but we'll be conducting in-depth interviews with around 15 people with dementia who live alone over sort of 2 to 3 interviews, and drawing on also observations and visual methods. and as well as interviewing some relatives and friends of people with dementia who live alone to get their perspectives, and service providers across NHS, social care and the voluntary and community sector. And then bringing this together with participatory workshops at the end, including system stakeholders and people with lived experiences. So I'll now talk a bit about findings from the systematic review. So this was a review of interventions for people with dementia living alone. And I want to thank Doctors Georgia Bell, Barbara Silarova, Molly Hebditch and Alison Tingle for working with me on this review. So the key questions we wanted to address were, what are the types of interventions, so non-pharmacological interventions, that have already been evaluated for people with dementia who are living alone, and what is the evidence of effectiveness, feasibility, acceptability, impact of these interventions. So we conducted searches across 6 different databases. The focus is on people living alone in the community, so not in long-term care facilities. And we were anticipating that there weren't going to be very many studies, so we took quite a broad approach in terms of the study types and outcome measures. So really any database study that's reported on the impacts of experiences or perceptions of an intervention were eligible. And we included either studies that were specifically focused on people living alone with dementia, or those that included people with dementia generally, but had some kind of subgroup analysis or reported separately on results for people living alone, and the qualitative review using a mixed methods appraisal tool. So this slide really just shows the kind of numbers of records that we identified and included. So around 6,000 records were identified through the initial search. But through title, abstract and full text screening, we've ended up with 17 studies. Although to note, this may increase because there are some studies which I'm still trying to identify full text or further details on. So these are preliminary results. Just briefly, in terms of the types of the characteristics of the different studies we've included, all of them from high income countries, so mostly from Europe and North America. In terms of study designs, there were just 2 RCTs and 2 economic evaluations that drew on data from randomized controlled trials, and the rest were from uncontrolled before-after studies or qualitative studies. In terms of the types of interventions, categorize these into sort of 5 broad areas, and most of the studies are focusing on either digital technology or some kind of home-based dementia care management, collaborative kind of care management, with fewer on social, cognitive or psychosocial interventions. Just over half of the studies were specifically on interventions that were kind of targeting people living alone specifically, and the others were where they had people with dementia generally, but had a subgroup analysis for people living alone. In terms of study quality, varied, and sort of, I'd say around a third were in the kind of low risk of bias category. These slides here are an attempt just to kind of summarize some of the key findings in terms of evidence of impact. So the studies are listed under the categories of intervention type, with the main outcome measured. And then I've kind of categorized the impact in terms of, for simplicity, in terms of positive, no impact, or mixed. And then the last column shows the risk of bias. So where I've highlighted in yellow, it indicates that there was a positive impact in a high quality study or low risk of bias. So in terms of home-based care, so the generally positive findings seem to be shown, and in particular to cost effectiveness analysis. So I think they're coming from the same study on nurse-led home-based collaborative dementia care management, which found evidence that this strategy was particularly cost effective for people with dementia living alone. When looking at the digital technology area, the findings were more mixed, both in terms of impact and study quality. So most of the studies were looking at remote monitoring in some form, and linking back to the talk this morning, there was very little kind of coming out in terms of the acceptability of this approach for people with dementia. For the cognitive interventions, so there's some evidence that maintenance cognitive stimulation therapy, so that was an extension of a shorter term cognitive stimulation therapy intervention, seemed to be particularly cost effective for people living alone with dementia. And some sort of generally positive findings coming from those social interventions, although all of these were really quite small scale qualitative studies. So just to summarize them from this systematic review, there seemed to be some promising evidence for these home-based collaborative care management approaches, so these sort of tailored proactive outreach approaches, including cost effectiveness for people living alone with dementia, but in general, a sort of lack of high quality intervention studies, and particularly a lack of interventions that are targeting those areas I mentioned at the beginning that have been identified as particularly increased risk for people with dementia living alone. So loneliness, safety, nutrition, and issues around sort of delayed diagnosis. I think quite a lot of the studies actually do collect data on living arrangement status, but they don't then tend to do any sort of further analysis by that. So there is, I think, more opportunities for subgroup analysis by living arrangement within some of these sort of existing or ongoing large-scale studies. And it's entirely possible that we may have missed relevant studies. So if they didn't explicitly state they were about people living alone, they would have been missed. So related to that, if anybody is aware of or knows of relevant initiatives or ongoing studies that we should be including or be aware of, then please do get in touch. Okay. Thanks very much for listening.